So let's talk about health insurance. So what should you focus on when you're looking at health insurance and choosing plans? So first you want to look at the deductibles, the amount you pay for covered healthcare services before your insurance plan starts to pay. So if you have a $2,000 deductible, you pay the first $2,000 of covered services yourself. So generally, plans with lower monthly premiums have higher deductibles, and plans with higher monthly premiums usually have lower deductibles. So next is copayments. Copayments are a fixed amount you pay for a covered healthcare service after you've paid your deductible. So it could be $20, for example. So generally, plans with lower monthly premiums have higher copayments, and plans with higher monthly premiums usually have lower copayments. So coinsurance is the percentage of costs of a covered healthcare service you pay after you paid your deductible. So that could be 20%, for example. So generally speaking, plans with low monthly premiums have higher coinsurance, and plans with higher monthly premiums have lower coinsurance. And you might be asking, what is a premium? And that is the amount you pay for your health insurance every single month. So let's just do a simple example. So let's say your health insurance plan's allowable cost for a doctor's office visit is $100. Your copayment for a doctor visit is $20. If you've paid your deductible, you pay $20, usually at the time of the visit. If you haven't met your deductible, you pay $100, the full allowable amount for the visit. And it works the same way with coinsurance, with the percentage amount. So why is healthcare so expensive? Many of us ask. And so I did some research, I did some digging because I was curious myself. So there's administrative costs that doctors and hospitals have to incur. There's high drug costs. There's a fear that there could be a lawsuit, and if there is a lawsuit, it is super expensive. Wages that they pay doctors and even administrative people, right? New technologies, so maybe the new MRI machine, whatever new groundbreaking technologies are expensive. And then there's just other miscellaneous costs at the hospital. So where do you get health insurance? So we have several options here. One, you can get it from an employer. You can get an individual plan, so that's like a private insurance. You can get it from the Affordable Care Act, or you could get it from Medicare. So let's talk about our employer insurance. So typically with employer health insurance, the employer splits the cost of the premiums with you. Your employer does all of the work choosing the plan options, and then premium contributions from your employer are not subject to federal taxes, and your contributions can be made pre-tax, which lowers your taxable income. So ultimately, if you have health insurance through your employer, then that is a great thing, and you definitely want to take advantage of that. Next is individual. So you can choose the insurance company, the plan, and the options that meet your needs. You can renew or change health insurance plans, options, and health insurance companies during the annual open enrollment period. The plan is not tied to your job, so you can change jobs without losing your coverage. You can choose a plan that includes the doctors and the hospitals you trust. You may be eligible for a subsidy from the federal government to help you pay for your insurance. So, if you seek flexibility, if you want to choose the plans, if you want to choose the insurance company, if you have these specific needs, if you want your health insurance to be portable, taken from different jobs, if you know the doctor that you trust and the hospitals you trust, then an individual plan might be the best option for you. And of course, you want to do research on that, further research. So next is the Affordable Care Act. typically known as Obamacare. So the Affordable Care Act has preventative care for free. It requires all insurance plans to cover 10 essential health benefits, which includes checkups, patient counseling, immunizations, numerous health screenings, treatment for mental health, addiction, and chronic diseases. They also have coverage for pre-existing conditions. There are premium tax credits that lower your health insurance bill. There are cost-sharing reductions, lowering your out-of-pocket costs for deductibles, co-pays, and co-insurance. And they also lower your out-of-pocket maximum, which is the total amount you pay in a year for covered health expenses. So if you do not have health insurance through your company, through your employer, or the individual plan might be too expensive for you, you can get a decent amount of health care through the Affordable Care Act, which is partially funded by the government, right? So Medicare. Medicare is for people 65 or older, and for people who are under 65 with certain disabilities, and for people of any age with end-stage renal disease, which is permanent kidney failure, requiring dialysis or kidney transplant. So there's different types of Medicare. So Part A, which is hospital insurance, helps pay for inpatient hospital stays in skilled nursing facilities, surgery, hospice care, and even some home health care. And then Part B, which is medical insurance, helps pay for doctor's visits, outpatient care, some preventative services, and some medical equipment and supplies. There are some services that are not covered by what they consider this to be original Medicare. So that could be dental exams, it could be routine eye exams, it could be hearing aids or related exams. Most care while traveling outside the US, help with bathing, dressing, eating, which is considered custodial care. Comfort items such as hospital phone, TV or private room, long-term care, cosmetic surgery, most chiropractic services, acupuncture, alternative treatments, routine foot care. So Medicare is obviously a huge governmental benefit for people with certain disabilities under 65 and end-stage renal disease, as well as people older than 65 years old. And it does cover a good amount, but there are things that it doesn't cover. So that's why you want to be aware of this system and do more research by the time you reach retirement age. So when can you get health insurance? So if you're getting the health insurance through your employer, I would encourage you to contact your employer, contact the HR department if you're not sure. Because I know with my company, when I first started, I could enroll about like a month after I started working. But the regular employee enrollment period was every January. So it depends. So I would contact your employer to get more information about that. Next is the individual plan. So enrollment is from November 1st to December 15th in most states. The Affordable Care Act also has open enrollment from November 1st to December 15th. Medicare, there's an initial enrollment period, and this is when you're first eligible to enroll in Medicare. So your IEP, your initial enrollment period, is 7 months long and happens around your 65th birthday or the 25th month of receiving Social Security disability benefits. So, dun dun dun. The health savings account. So we've talked about where you can get your health insurance and all these different types of plans. And I just want to bring attention to the health savings account, or the HSA, which is a high deductible health plan plus a medical expenses savings account that literally everyone can have access to, right? So there's a contribution limit to the health savings account. So look here. This is 2020 and 2019, and we can see the comparison if there's a change from 2019 to 2020. So the annual HSA contribution limit, employer and employee, you see in 2020 will be, if it's only you, it'll be $3,550. If it's a family plan, it'll be $7,100. If you are 55 years or older, you can have catch-up contributions. So you can contribute $1,000 extra. So your minimum annual ADHP, high deductible health plan deductible. Yeah, that's a mouthful. High deductible health plan deductible. So that minimum, if it's just you, is $1,400. If it's a family, it's $2,800. And then your maximum out of pocket for your high deductible health plan is $6,900 for yourself and $13,800 for your family. And so you can see that includes deductibles, co-payments, and other amounts except for premiums. So you're saying, okay, you're telling me about these contribution limits. Cool, but what even is an HSA? So think of an HSA as if it's a debit card where you rack up money in your account by contributing to it each month, which you can use for your current and future medical expenses. And some employers even will contribute money on your behalf. So ADHP is a health insurance plan with a higher deductible, but a lower premium compared to a traditional health plan. You can use the money you contribute to your medical expense savings account to help you pay your deductible. So let's go through an example so we can fully understand it and see how we can take advantage of the HSA. So, say I plan to contribute $3,450 in 2018 as a single household, and my insurance plan's deductible is $2,000. Say my employer contributes $450 annually, so I will only need to contribute $3,000. Say I need to get prescription drugs for some random illness. The money I've contributed to my HSA debit card will go to pay for the prescription drugs and will get me closer to reaching that $2,000 deductible. So the traditional plan works like a car or renter's insurance protection. In the traditional plan, you're paying money to the insurance company whether or not you actually get sick. Once you do get sick, you will typically pay 20% of the medical expenses out of pocket, but you probably won't have a designated budget for your medical expenses like the HSA. So say goodbye to your Christmas gifts budget. The reality is, however, that you should go for a traditional plan if you and or your kids frequently have medical expenses. But if you and your kids are pretty healthy, offer the HSA to cover your medical expenses because you'll have a premium that's typically lower than a traditional plan's copay. So if you want to know what medical expenses the HSA pays for, there's a full list here, so all you need to do is click here. But some of them include vision care, therapists, nursing home, co-pays, co-insurance, prescription drugs, ambulance. There's like such a huge list. It covers like literally everything, like literally almost everything. So take a look at that list. So the reason that I love the HSA is because it's covering you in terms of health expenses, right? You kind of have this like designated budget for your health expenses. But it's such a great financial vehicle. Like if the health benefits are out of the charts, like it's just like the financial health benefits are like astronomical. So let's go through the reason why. There's tax-free contributions. So when you contribute money into your HSA, the money you contribute is not taxed. Woo. Tax deductible contributions. So you can deduct the money you contribute to your HSA from your federal gross income up to the contribution limit. So this means you're effectively receiving a tax break because the amount you contribute to your HSA is lowering the total amount of income that you'll have to pay taxes on. So if you contributed the max of $3,450, which was in 2018, the max for an individual, and you make 50 grand a year, your taxable income would have been adjusted to $46,550. So then there's tax-free withdrawal. So you don't pay taxes on money that you withdraw to pay for your medical expenses. So note that if you do withdraw money for any other reason than for the qualified medical expenses that are on that list, check them out. That withdrawn money will be taxed as ordinary income, and you also have to pay a 20% penalty fee. However, you will not have to pay the penalty if you're 65 or above or become disabled. Next, tax-exempt earnings. So if you have unused money in your HSA account, you're in control of where you want to invest that money. So if you earn interest or dividends from those investments, this earned money is tax exempt at the federal level. So this is an excellent plan for your retirement plan. When you're 65 plus, you can use this money on non-medical expenses while paying taxes once. Or you can use the money for qualified medical expenses without paying taxes when you probably will need more money for medical expenses at that age. Either way, your account is growing over the years and thus your total wealth. So yes, we're taking advantage of compound interest here. And then you're saying that I'm going to not even have to pay taxes? Okay, yeah, if I use it on non-medical expenses, I'll have to pay ordinary income tax, but okay. If I don't use it on non-medical expenses, I do use it on medical expenses, which I'll probably need to do anyways. It's not going to be, the earnings won't be taxed, right? The withdrawals won't be taxed. And then rollover, the concept that all the money that you've contributed plus all the earnings rolls over year after year after year after year after year. Well, this is like a secret that really shouldn't be a secret. If you can contribute for your family around 7 grand, 8 grand a year, specifically for health savings, you already have fulfilled your health budget, right? You're planning for retirement at the same time. You're investing at the same time. You're getting tax advantages at the same time. What is not to love? So you might ask, where do you get an HSA? So you can just go through a private health insurance company. Your employer might offer an HSA, and they might also contribute money to it too. So you need to definitely check into that. Call HR, email HR, chat HR and figure that out. Or you can go through a bank or credit union. So you don't need to work at a traditional company to take advantage of an HSA. Research your options, and I highly recommend that you look into it and see if it's going to help you with your financial health as well as your physical health.